Welcome, 2021 blessings. This is Brenda Charles Edwards, the host of Seniors Matter. We're live every Friday at 12:30 p.m. Pacific Standard Time on www. Rainier Avenue Radio World, your community radio station. We're also on YouTube and Twitch. You can also listen to us on Rainier Avenue Radio App and on Alexa. You can view us on facebook.com/Rainier Avenue Radio World/videos. Seniors Matter impacts and invites a variety of guests to discuss issues and activities that impact the lives of older adults and their families. If you have any questions, please put them in the comments section on Facebook or call in at 206-290-9685. January is Cervical Health Awareness Month. My special guest is Ms. Eudora Carter, Project Coordinator at Center for Multicultural Health, a community-based organization founded in 1976 in the Central District.
Good morning.
Welcome, Eudora. How are you?
I'm good. Thank you. Thank you so much for having me on.
It is a pleasure. So let's just jump right into this. What is the mission of the Center for Multicultural Health?
Our core value that started even when we were just thinking about us was promoting the health in diverse communities. To underserved people, we've been in the CD since 1976. We were on the in the Urban League building on 14th and Yesler for over 30 years. And we are just about 6 blocks away now on 12th Avenue near Jefferson. But we have to reach out to our community who was underserved, who didn't feel that they were heard by the medical community, to help them work through the healthcare system. And when they feel that they aren't being reached or aren't being heard, to be the navigator for them, to help them.
So how long have you been doing this work, Eudora?
I've been working in community outreach and education since 1994. I did a bone marrow transplant at that time.
And a what transplant?
Bone marrow.
Oh, wow. Okay.
And so I've been doing outreach and education about health issues, starting with that. And now I work with diabetes education, health monitoring for blood pressure, hypertension, women's patient navigation for our mammogram program, colon health, anything that our communities need to be reminded and educated on for their own health values.
So how are you working during this COVID shutdown, Eudora?
It is a whirlwind. We've had to pivot. We're minding our own business, and then the COVID hits. CMCH, Center for Multicultural Health, we had to pivot. My work and my co-workers is outreach and education, meaning we go out into the community. We meet with groups where they are in their communities. We've pivoted insofar as now we are the resource for assistance, for unemployment insurance, for health insurance. We've taken on food insecurity. Since early summer. And by that, we had twice a month food distribution with our drive-through. We work with Food Lifeline to provide boxes of shelf-stable items, a box of produce. We've worked with distributing $400 in grocery cards, and we provided ethnic, cultural appropriate boxes for the African American, the Pacific Islander, the Hispanic, the Asian communities, where we did the grocery shopping of foods of their culture. They're appropriate. And we distributed those right before Thanksgiving and through December.
So Eudora, are you going to be at Mount Zion on the Friday the 15th for the God's Groceries with your resource table?
We have been participating in God's Groceries since they started in August, I believe that was. And we provide a resource table. We distribute masks, hand sanitizer. I still want women to participate in their annual screenings. It's still so very important because it's sort of like a domino effect. If you can't go to your medical center in person, then they have to furlough those medical providers. The centers have a COVID procedures where it's safe to come in. It's just a little bit slower, more focused, but you are safe going into the medical centers and you still stay on top of your annual health screenings. As you mentioned earlier, January is Cervical Cancer Awareness Month. And I want to encourage all women to go in for your annual screening if you need to have one. Gentlemen, I want you to go in for your annual exam, just period. We know how you're very interested in getting your annual screening done. I want to encourage you. I want to encourage you.
Yes.
It's really important for your own health to find out where you are. Also, see what your blood pressure is. African Americans are prone to high blood pressure, which can lead to other complications.
Well, especially now since with COVID, if you have any underlying condition, health condition, which that's one of them, you're at greater risk.
Absolutely. Absolutely. And you don't want to take we're very proactive with our clients and with our new clients. We want you to start out at the best place possible. And as you mentioned, having diabetes, high blood pressure, concerns with your kidneys, all of these things, particularly people of color, are susceptible to, one, because they don't get the medical attention they need when they need it.
Right.
And so with COVID, where we've been able to provide COVID testing, we had a health fair in October where we partnered with Neighbor Care Health to provide COVID testing. We had a mammogram. We had other health screenings that we do here at CMCH, blood pressure, blood glucose, because even though we are in this very weird, stressful time, as soon as you can, we need you to get back into your health screenings.
It's very important. Mom and I, we do ours every year. We make it a little date.
There you go. There you go.
It's definitely important.
Absolutely, especially in this time when you want to put it off, because this year has been one we have not gone through in the last 2 generations of anything this stressful. Right. And we still don't know. We have the vaccines available now. I just got some information this morning about how that's going to work in Washington State. But what I want is to include,
Before you go into that, let me just take a quick station break because I don't want to interrupt you. Okay. So if you're just tuning in, you're listening live to Seniors Matter with your host, Brenda Charles Edwards on www.RainierAvenueRadio.world, your community radio station. And you can hear us on the Rainier Avenue Radio app, Alexa, and you can view us on Facebook, YouTube, and Twitch. These are 2 new ones. And just want you to know, if you don't already, that Seniors Matters provides you with information about resources that can benefit you, your family, and the community. And also, speaking of community, there are commission positions available on the Mayor's Council on African American Elders. If you're interested, please contact Ms. Karen Winston at karen.winston@seattle.gov for more information. Now back to my wonderful guest, Ms. Eudora Carter, who is the project coordinator for Center. Let's see, how do I say it? Center, no, it's CMCH, Center for Multicultural Health. Yay.
It's a mouthful. It's a mouthful.
Conducts community outreach and cancer prevention education and patient navigation in communities of color to medically underserved African American women and women of African descent to the spouse. Boy, what is going on today? Facilitate referrals to a medical home for health care. Yes, got it, done. Okay, go ahead. Let's talk about this vaccine, Eudora.
Okay, tying into that for your listeners, I want to encourage them to use their medical office. That's where you will get the most up-to-date information on you if you have a patient portal. That's something, for example, if you go to Swedish or you go to University of Washington Medical or you go to Virginia Mason, each of those entities have what they call it is a patient portal.
My chart.
Sorry?
My chart is one. I have that one.
There you go. UW has My Chart. Virginia Mason has My VM. And using this portal, you open it up with a username and a password, but it lets you communicate directly with your medical team. Right. You can look in on your records, see your test results. You can schedule an appointment. You can have conversation with your medical team. It's a lot quicker than trying to give a phone call to your team. It's available 24 hours. You can also have access if you need a prescription. It can let you have a televisit if you need to touch base with your doctor about replenishing a prescription. It's called a patient portal. And I want to encourage everyone to find out where your medical center is and ask them about opening up a patient portal for you. Particularly during this time, they can give you information on scheduled appointments for your annuals, for your COVID testing. Each one will have the most up-to-date information from the Department of Health on what level of COVID testing they're at and where you fit into that. And as I mentioned earlier, you may have noticed in the news, there's a lot of confusion on what type of vaccine we have available here in Washington State / Seattle, Greater King County area. It doesn't make a difference which vaccine you're using, rather the Pfizer vaccine or the Moderna vaccine. You need 2 shots for the vaccines, several weeks apart. Right now, Washington, D.C., as you can imagine, they're going through a transition. Some of the vaccine shipment
has been delayed because of all of the confusion in Washington, D.C. One of the things, too, I'm sure Eudora will talk about in a few minutes is the different levels and what they mean and the age bracket and your occupation that you have to be in to get these.
Vaccine for the second shot. What I wanted to impart on your listeners is what the tier level is right now. In the news, they are talking about tiers. Right now, we're in tier 1A. And that is the workers that are working directly with patients. That covers the medical staff, that covers the housekeeping staff, that covers the food workers. There's a lot of folks behind the scene that are right there with the patients. This is the time where they are the priority to get their vaccine shots.
So.
Mm-hmm. And along with that, and these updates will be coming, I think, weekly right now, but that could change on a dime. So I would encourage you to watch your newscasts. But right now, they are not anticipating anyone outside of long-term care facilities. So we have essential workers. We are going into long-term care facilities. Those are nursing homes, convalescent homes, adult home care centers. So those are the original priority.
So those are the workers there at those facilities, correct?
At those facilities, the workers and the patients.
Okay.
Okay. So if you have a patient at a long-term care facility, they will be getting their vaccinations first. There are staff at Walgreens, staff at CVS drugs who are trained like they do for the flu shot.
Sure.
We're able to go into those drug stores and see their senior staff, the pharmacists, the medical aides. They will also be able to distribute the flu shot. So we're widening up the outlets for the flu shots. And it's a matter, they're saying in later spring, like May, that the next stage will happen. It just depends on how quickly they get vaccine into arms. Your best bet, if you have questions, again, is to contact your primary care doctor and see if you have underlying conditions, any one of several chronic illnesses that could scoot you up in the line, because those with other concerns are more susceptible. So,
sure.
As I said, if you get a patient portal, call your doctor's office. Have your family member call the office for you to see where you are in that triage for that. Because if you have underlying conditions, you're at a higher risk for developing the virus.
So I noticed on the TV this morning, on the news, that you've heard about, what is it, the variant of the virus that
Yes.
happened in England. And I noticed that it's in a couple states in the US. Fortunately, ours is not one of them.
Mm-hmm.
But it's just, then they were saying how you could be, what is it, asymptomatic.
Mm-hmm.
And pass the virus on to someone. That's why, I really, and I know I'm preaching to the choir when I say, I really have a problem with people not wanting to wear a mask. Because if you don't want to do it for yourself, then do it for somebody else. Think about your mother, your grandmother, your siblings, your husband. I mean, it's just, I just don't get it. And I know it's uncomfortable at times.
Mm-hmm.
There are definitely some slight side effects depending on how long you have it on. Like those poor doctors and nurses, they probably have rashes on their face from keep getting the moisture. But overall, it's going to help you. It's not going to hurt you.
Right.
And it's not a political thing.
Right.
As some people like to make it.
Absolutely. You want to, it's all part and parcel of limiting how much you expose yourself to other people. So if you can manage not to go out of your home, then you can go through your home without having a mask on. The more people you are around, the more necessary it is to protect you and to protect others is to wear a mask. If you have young people in your family, you don't want to spend a lot of time around them. Asymptomatic means that you are carrying the virus, but you don't have any symptoms of it. It's very much like when a certain generation, when you had chicken pox.
Oh, right.
Or the mumps. You didn't know you had it until the rash started, but that could be 5, 7, or 10 days after you're exposed. And you don't know you have it, but you're a carrier of it.
Right.
So this is a virus, as those are viruses. We always are around viruses. This one is super critical. So limit how often you are among people. If you live alone, if you can get one of your family members to do your shopping or to check in with you, keep them at the door. Just limit that constant, keep your hands washed, because you can have the bacteria on your hand. These are strategies we've used for cold, for the flu. I heard on the news that the flu is down 98%.
Oh, my goodness.
I think the reason is we're masked up. We're washing our hands all the time. We're not exposed to people. So the flu went down. That's a good thing.
Yes.
But you still need, depending on your personal matter, still get a flu shot. It's still flu season until early spring. And you can't tell if you're going to get it or not. So
I hear you. I used to travel to Asia a lot. And I always thought it was kind of odd seeing the people there with masks on, not really understanding. They weren't doing it because they were sick. They were trying to keep from getting sick and infecting anyone else. And now here we are.
Exactly.
The same thing. So I just said, boy, you just never know.
Exactly. And our challenge, as you said earlier, was not, we can't be ordered to wear a mask by each state. The Department of Health, the CDC, the health centers are trying to give us enough information so we see the value in that. As a health worker, I go throughout the community. I'm around a lot of people. I've been doing flu shots since back in the day when they had swine flu.
All right.
It's a virus. You don't see it. It just is there. So it's really nothing new. It's just so frightening.
For sure.
We have not lived through a pandemic.
Right.
Or what it was 100 and so years ago. And now, as you said, it's not a political movement. It's a health movement. And the United States has climbed to the top of that ladder, unfortunately. So the most recommended is, if you have not received a flu shot, please get a flu shot. What that does, any of the vaccines tells your body to look for this particular germ. And so when you get a flu shot or the COVID shot, it's going to tell your body, you want to look for this red dot. And so your body starts making soldiers. So if you do get it, it's not a guarantee that you will not get it. But if you do get it, you already can open the garage and all those soldiers come out. And you will not get it as bad as you might have. And you do not have to take the week or 2 weeks or 3 weeks to build up your antibodies for it. That's what any of these vaccines are for, is to get your body on the alert to look for this particular thing. And if you find it, to attack it and destroy it. And so
I love your analogy. That is just wonderful. I'm a visual, and I'm sitting here and I'm seeing these soldiers and those looking for this little red dot. I love it. That's great.
Oh, and that's, people have concerns about the flu virus. Well, I get sick. You do not get live virus in either of those things. It's a strange entity in your body, and your body is doing what it's supposed to do. You may get overly warm. That's your body turning up the heat on whatever this strange thing is in your system. So that's a good thing. Your immune system is working, but it may make you congested. It may make you feel odd, but that's your furnace turning on to make all these little soldiers. So just be patient with that while your body works through it, and then you start building your defenses. And with the COVID, you need to have 2 shots to have between 90 and 95% protection against them.
And what I read, and actually, are you familiar with blackdoctors.org?
Yes.
So they had a program on yesterday, and I was listening to it, but it was very enlightening,
Mm-hmm.
and it will be televised again. I watched it on YouTube yesterday.
Right.
Did you see it?
I did not see it. I'm going to check back on it because the timing wasn't great for me. But information, people, when you live in a vacuum, your imagination goes off and you listen to the loudest voice, whether it's positive or negative. And then the more information you have for yourself, if you can reach out to your medical team and ask your questions, ask them questions. Just don't think that they won't pay attention. As I said, the patient portal is a direct email to them.
Right.
But ask your questions. Try to get as much information. Make yourself as informed as you can. That's what CMCH does, is to get the information out to people who may not have access to it.
Miss Eudora, what is the phone number that people can call for more information?
You can reach me at 206-461-6910, and my extension is 218.
Fantastic. It has been a pleasure having you on the show. I just want to say that for those of you that may have tuned in late, you can listen to this broadcast again. We are on Rainier Avenue Radio Facebook.com/Rainier Avenue Radio .world/videos. I tell you, there's so much to remember. But anyway, this is Brenda Charles Edwards, host of Seniors Matter. You've been listening live. We're here every Friday at 12:30 Pacific Standard Time. If you need financial documents notarized and you're a senior that needs documents read to you for clarity or completion, call me, Brenda at Black Orchid Notary, 206-683-2636. Tell me where, I'll meet you there. Ms. Eudora will be talking later. Now, next up will be the coronavirus, and just live your life like it's golden. Goodbye, Eudora.
Bye-bye. Thank you so much for having me on.